Hey, it's Jordan, super passionate hospice nurse, and I want to talk about a few things that I hear that are myths in the community and trying to just make some understanding more about hospice. First is hospice takes away medication, and hospice just pretty much makes you go on comfort care. That is kind of true. Like, we put people on comfort care, but we don't take away your medicines. The physician that is referring you has to hospice, a medical director of hospice reviews your medication saying, hey, these medicines, this patient should continue. This is benefiting the patient. This is helping the patient. These medications are not. So let's talk about the not. Let's say you're admitted onto hospice and your blood pressure is kind of soft, like 100/60. Well, you're on 100 milligrams of metoprolol, a blood pressure med, low sart, all these things. Let's kind of taper down your blood pressure meds. Let's give you some more energy back so that you have more time. So we'll alternate kind of looking at how you're feeling day to day to then to see what's affecting you, right? So if your blood pressure is low, let's look at your blood pressure med. Okay. And we just look at things. We don't come up and karate chop all your medications away. We also don't just say, here's all of these comfort meds. That couldn't be far from the truth. We look at what are your symptoms now. Are you having nausea, vomiting? Are you having severe pain? Are you having severe anxiety or agitation? Are you hallucinating? What is happening? And we go from there. We don't come into your world going, here's what you're going to do. It's like, no, how can we serve you? How can I make your day-to-day the best it possibly can be? I've even talked to physicians and nurse practitioners and people that work along going, this person really wants to make it to Christmas. We're 2 months away. How can we try to give her more energy, more oomph? And sometimes people are put on a low dose steroid or a certain type of situation to help give them as much time as they can without taking end of life meds. And I just want to encourage people, hospice is here to help your day to day. Not to stress you out, not to make you scared, to help your day to day. Because what I think is beautiful is when you allow and accept hospice into your heart, I guess you would say, you start to see the positive changes of comfort. Comfort treatment is active treatment. We are actively treating you. Hospice is 24 hours. A nurse is available 24 hours. Granted, it's not always me. It's not always my coworkers. It's not always, but we're always available. And I just want to take away those myths of they're just going to come in, you're going to do this, and you're going to pass. No. We look at what's going on. Those medications that you're giving your loved one is because they're going through those symptoms. You're giving them the peace they need. You're giving them the rest they deserve. You're giving them the end result they want, to be at home, to be where they're at, and to be at peace. I can't think of a bigger blessing is to fall asleep and pass away in my sleep. Like, don't we all want that? Unfortunately, we all don't receive that. And I think that's the beautiful thing of hospice is that's usually how it goes. I know there's circumstances where things are different, but I just want to give comfort to those who are going through hospice or caring for someone in hospice, and I hope this brings you peace. Thanks so much for listening. If you have any questions, let me know. Thanks.